Good morning, everyone. My name is David Campos. Welcome to Facebook Live with the County of Santa Clara. I am here with James Williams, who is our county counsel. Before we begin, I just want to note that we are taking off our face coverings so that we can allow the ASL interpreters to properly interpret the content of the program for our hearing impaired viewers. As a best practice, they're not able to do that translation, that interpretation, without us actually taking off our face coverings. I also want to note that at the bottom of the screen throughout the program today, you will see the numbers, the latest numbers in terms of COVID cases for the County of Santa Clara. So again, David Campos here. I am very honored to welcome James Williams, who is the county counsel and one of the directors of the Emergency Operations Center. Welcome back to the show, James.
Thank you.
So we are here today to talk about the most recent order that has been issued by the public health officer, Dr. Sarah Cody, and it has to do with testing. So it was issued last week. It goes into effect on Friday of this week. So can you tell us, James, what is this order about?
Sure. I think the first thing that's important to recognize is, why are we even doing a testing order? Why is testing important? Dr. Cody from the beginning has been actually quite clear that testing is essential. It's really at the beginning of us being able to identify and then break chains of transmission. And if people who are symptomatic or suspect that they have COVID, or people who have come into close contact with someone who is confirmed to have had COVID, or someone who has regular or frequent interaction with members of the public because of their work, those are all categories of folks where it's vital that there be testing to catch cases, to help support the isolation of those cases and quarantine of individuals who've come into contact with them. And that's how we break the chains of transmission and keep COVID as contained as possible. The other important thing about testing is without regular, frequent, accessible, timely testing, we can't know what's going on. We can't see the spread of COVID in the community. And testing has been such a challenge right from the beginning here in the United States, and it's really been hindering the effectiveness of the response nationally, across California, and even here locally. But here in Santa Clara County, there have been extraordinary investments in testing, extraordinary push to provide and expand testing. The county itself, through its own health system, has stepped up and done a tremendous amount of testing, free, accessible testing throughout the community. But part of actually being able to get to the level of testing that we need is that we also need to have all of our healthcare systems do their part too. Just like for any other illness, just like for any other condition, we go to our normal primary care provider. We go to our normal doctors, our normal clinics, to get treatment, to get tested. That is equally true, just as true for COVID-19. And so back in June, actually, the county health officer issued the first order related to testing, requiring that large healthcare systems step up and provide testing for priority categories. And what was announced last week was really an enhancement of that order, which goes into effect this Friday.
Now, James, I remember before the June order was issued and I remember having conversations with folks about hoping that there was no need to issue the order. So can you talk a little bit about that so that people understand that it wasn't like you just issued the order, that you actually tried to figure out a way of getting these providers to do testing without an order, and likewise, why a second order? So what's going on here?
That's exactly right. Right from the beginning, there have been conversations to provide assistance, to provide support, to help with supply chains, to help with providing recommendations. And the Public Health Department from the beginning has been pushing out guidance on testing and priority categories for testing, and urging testing, and also providing a lot of support and resources to promote testing by large healthcare systems. These are the systems that actually are responsible for taking care of the vast majority of residents here in Santa Clara County, and they're well-resourced systems. And so even though it's hard work, and even though supply chains sometimes have been very challenged and impacted, these are systems that have the wherewithal to step up to the plate and get us where we need to be for testing, just like the county's own health system has done.
Well, one of the things, James, that we have heard, or at least members of the public have heard from some of these systems, perhaps an explanation or a justification, is that it's really hard to get the supplies, to get all the things you need to make testing happen. I know I've heard that repeatedly, and yet the county has been able to overcome some of those same obstacles. Can you talk a little bit about that?
Yeah, that's exactly right. The county, operates Valley Medical Center and its clinics. The county has its own large health system and faces the same kinds of challenges. It is hard. We have had challenges nationwide in having access to reagents, to supplies that are needed. Turnaround times have been challenging, but these are all obstacles that through diligence and hard work and dedication from our staff at the county, we've been able to overcome. We've been able to build in redundancy, and we've been able to provide accessible testing to the community. I think the most significant recent example is stepping up at the fairgrounds site, where we now can provide 1,500 tests on a drive-through basis throughout the week, daily. So, these are challenges that are real, but they're absolutely challenges that can be overcome, and we know that because we are overcoming them.
Now let's give some specific numbers here. To some of the numbers, we looked at the week of August 31st through September 6th. During that week, Kaiser Permanente conducted 4,261 tests, Stanford 3,243, Sutter 1,426, El Camino 679, HCA Healthcare 633. Again, the highest number, 4,000. In that same period, the county conducted 13,000. So you can see the difference, and it's not like the county doesn't have the same challenges.
That's exactly right, and we actually have, we have all this information on one of the dashboards on our website. You can go and monitor the progress yourself. You can look at the rates based also on the patient population served to get a sense of what's the magnitude versus how many patients that system normally takes care of for healthcare needs. And it shows the disparity is quite stark and significant.
Now, James, one of the things that I saw in the order was this notice that has to be put up by the providers. Can you talk a little bit more about that?
Absolutely. So the recent order was issued to really provide some more, to enhance the June order in order to better achieve the goals. One of those requirements is a requirement that these systems provide affirmative notice to patients. That means you'll see, once the order goes into effect, you'll see notices in patient waiting areas. You'll see notices on websites. You'll see notices in communications and materials related to COVID-19. That's so that people then know who is eligible and what the requirements are. So let me cover some of those, because I think that's really what's critical. So who's eligible? Anyone who is symptomatic needs to get tested. Anyone who has COVID-19 symptoms. Anyone who has been a close contact with a case, whether or not they have symptoms. And by the way, there was recent controversy around some CDC guidance that has now been rescinded and replaced that suggested that if you did not have symptoms and you were close contact, you did not need to be tested. That was wrong. The CDC has now put out revised guidance, but our local health officials have been very consistent. If you're a close contact, you do need to get tested, regardless of whether you have symptoms. Third category, anybody referred for testing by the public health department, especially through the contact tracing process. And then the fourth category, and this is a really important one for the broader public, anyone who's an essential worker. So what does that mean? An essential worker, we have actually now aligned with the exact same definition from the state for the mandate the state is placing on insurers for COVID-19 testing coverage. And that definition of essential workers is quite broad. It includes teachers, grocery store clerks, agricultural workers, obviously first responders and healthcare workers, but many, many categories. And you can take a look at either the state definition or ours, because they're now the same, and see it's a long list of folks. But basically, individuals who are in kind of work where they may come into frequent contact with a large number of individuals. Those essential workers, even if they're not symptomatic and even if they're not a close contact to a case, can and should get tested, and the order requires that these providers provide that testing to their patients every 14 days.
Let me ask you a couple of questions about, let's say that you call Kaiser, and I'm a member of Kaiser, and you tell them that you're symptomatic or that you were exposed to someone who had COVID. Do you have to prove that to them? How does that work?
That's a great question. So one of the things this enhanced order does is tries to remove some of the barriers that people were reporting to us as challenges to actually getting testing and getting tested quickly. So the enhanced order includes requirements that the healthcare systems make testing easy and accessible, that they remove impediments to that testing, like complicated phone trees or requiring appointments with doctors if you're not symptomatic, and requires that the testing be provided timely. So if you're symptomatic or a close contact or referred for testing specifically by the public health department, that means within the next business day if you call or electronically schedule. If you're an essential worker doing routine surveillance testing on the periodic basis, that means within 3 business days. And then also a requirement that results be timely. We know that that's been a challenge as well. And so the order requires that healthcare systems provide results within 3 business days, or if there's some reason they can't, they need to affirmatively tell the county what they're going to do to resolve that backlog, because we know that a backlog in getting testing results really has a negative impact on getting people quickly contact traced and breaking those chains of transmission.
So for viewers out there, let's say that one of them goes to Kaiser or Sutter, and for whatever reason, maybe they get their runaround. What are your options? What do you do?
So if you're having a problem getting tested, first you should remind your provider of these rights through the patient notice. But if you have any violations that you believe are occurring, we have a website with a dedicated complaint portal and a phone number. I think those are being displayed on the screen, but the website is scccovidconcerns.org. It's scccovidconcerns.org. And you can go there. You can actually use the same portal to file complaints about the other health orders too, but it specifically includes this testing order.
Now, James, we, as you know, we were moved into the red risk level, and if after being there for 14 days, your numbers still remain more or less in that area, you have the option, school districts do, of opening up in-classroom learning. Can you talk a little bit about the connection between that possibility and the importance of testing?
Absolutely. So it's possible that we'll find out that, we'll find out that news tomorrow, so we'll see. But that's, I think, a reasonably likely outcome. School opening presents a lot of volume. A lot of volume of interaction, and so it's very important that we have a robust testing infrastructure. And so the testing order does include teachers and other school staff and school workers as essential workers who can get tested through their healthcare providers. And that's going to be really important in helping ensure that we are keeping on top of things as schools now open up. We want to stay in the red tier. And in fact, actually related to testing, one of the only reasons we entered the red tier is because the state, through this new system, gives an adjustment based on the volume of testing that's occurring. And because our county is one that tests above the state average, we got credit towards that adjusted our case rate down from the purple tier into the red tier. And so that's important too. But as we move forward, expanding testing is absolutely critical. Having accessible testing is absolutely vital. And our need as a community, as a collective community, is for all of our large healthcare providers to do their proportionate share in helping take care of us through this healthcare crisis.
Now, James, I know that we don't really want to get to this point, but what happens if after all of this, the issuance of an order, a revised order, if any of these providers still refuses to enhance their testing? What are your options?
Well, some have heard me say before, these health orders are mandatory. They are the law, and we take that very seriously. And so if there are violations, do report them. SCCCOVIDconcerns.org. We will investigate them. This order is covered under the civil enforcement structure that the county adopted in early August. That means that providers that violate the order are subject to fines and are potentially subject to other remedies as well. And that's something that we are keeping a very, very close eye on. Our expectation, just like it is for all the businesses in our community and all of our individuals and families who have been doing such a great job for so many months now in closely following these state and local public health orders, our expectation is that these large healthcare systems do exactly that as well. But we are prepared to take enforcement action if we need to.
Now, I remember when the issue of testing was something that we were focused on even more so because we're trying to ramp up our testing, that it came down to investment, right? It takes a lot of money being invested to be able to overcome some of these hurdles. So this is just me talking. It seems to me that if these private hospitals are willing to put in the money to actually have the level of testing that is needed, that they can actually do it the way the county has.
I think that's true. I would add, that federal and state regulations mandate insurance reimbursement, so that is there too. And this is part of the standard of care now. COVID-19, this pandemic, is the critical health issue facing our community. And so for our healthcare systems to make the investments needed to deal with that, I think is an expectation in our community, not something that we would say is, should be unique. It should be the standard. It's the standard of care.
Well, I think that probably says it better than I could. So, James, thank you very much for the opportunity.
Thank you.
To those of you that are watching, please make sure that you continue to monitor our website, our different dashboards, and make sure that you understand your rights under this new order and that you exercise those rights and report any violation. To everyone out there, please have a wonderful day. Stay safe. Be careful and stay tuned. We will be having actually an on-the-field event coming up on Wednesday. We will be in East San Jose talking about the efforts to do outreach to one of the hardest hit communities with respect to COVID. So stay tuned. And of course, we have other Facebook Lives that will be taking place in Spanish and Vietnamese later this week. Thank you very much. Enjoy your day.